be hard to believe, but there are still procedures being done these days that are outdated, they're no longer supported by research, and they're not even recommended by the American College of OBGYNs. Now, it's important to know these procedures and these policies so that when you go into labor and are ready to give birth, you know all of your options, know what to expect, and can make the best choices for you and your baby. Now, if we haven't met in real life, my name is Alice Turner. I'm a birth doula, a Lamaze certified childbirth educator with an engineering degree, and on my channel, I make videos where we break down topics about childbirth to help you prepare and help you have a positive birth experience. Today, we're going to talk about 6 procedures, and I'm going to go through them in order of least common to most common, and we're going to dive into what's being done and what research suggests so that you have all the information and you'll be ready to go when the big day starts. Least common and probably most uncomfortable is the enema. So enemas used to be standard. You'd get into your hospital room, get situated, and your nurse would give you an enema. So this is no longer standard practice. It's definitely not supported by research, but there are some hospitals that still offer an enema. So I want you to know that if you refuse an enema, you are going with current research and skipping something that you probably don't want anyway. Number 2 is being confined to the bed for both labor and for pushing and birth. So it used to be very common practice to encourage women to stay in bed in labor so they can be monitored, so that they can be managed. And this was even carried through all the way until pushing and birth, where many women were giving birth laying flat on their backs. So this practice is not currently supported by research. Research actually tells us that movement in labor is very helpful. Helps the baby move through the pelvis, helps labor along and progress, and that giving birth on your back is not really the best position for birth. So more information about movement in labor can be found below. So that hospital bed is not somewhere that you have to be trapped in labor, and it's actually encouraged to get out of the bed and consider alternatives to laying flat on your back for pushing as well. Number 3 is routine episiotomies. So an episiotomy is where they cut the tissue in your vaginal opening to make it bigger, and this, thankfully, is no longer standard practice. So a lot of research came out not too many years ago that said that it's healthier for your tissues and would be a decrease to injury in your tissue if you allow your body to tear naturally. So episiotomies should really only be done in case of fetal distress. Now, what's crazy about this, and again, remember I said I started with least common to most common, and episiotomy is right in the middle of this list. There are areas of the country and doctors that are still performing routine episiotomies. So where I practiced in Atlanta, I knew of a couple doctors that had episiotomy rates that were still in the 90% range. So I really want you to know about your options with this procedure, and also be aware of signing any consent forms that state that you are consenting in advance to an episiotomy. So as of this year, 2020, I know there are hospitals out there that are still having their patients sign consent forms for an episiotomy when they check into the hospital. So I don't recommend that because research and the American College of OBGYNs do not support routine episiotomies. Number 4 is the practice of putting babies in a baby warmer right after birth. So it used to be very common that as soon as a baby was born, they were brought over to a baby warmer in the room, and there they would be assessed medically, find out if they're okay, wiped off, and then they would be brought back to mom. So evidence is really clear. There has been a lot of research stating that babies do the best when they are skin to skin. More links down below to a video just on skin to skin. So check that out. After your baby is born, 1 hour skin to skin is really the best and the healthiest for the baby, but it's included in this video because I still hear about people having to fight for skin to skin time. And what true skin to skin time is a baby that is not swaddled up like a baby burrito, but their naked skin against your naked skin. Number 5 is the practice of immediate cord clamping and cutting. So up until just a few years ago, the practice was very standard that as a baby was born, whoever was catching the baby, the doctor or the midwife, would clamp the baby's cord and then cut it immediately after birth. But research tells us that babies really do better with a delay in the cord cutting and clamping. So the part that's a little confusing is how long of a delay. The American College of OB/GYNs at the time of this video are recommending between 30 seconds and 60 seconds of a delay. Now, the World Health Organization has a different take on this, and they're saying around 1 minute to 3 minutes of a delay. But regardless, the practice has changed, and research really supports the benefit of delaying that cord cutting. But as I said, we are getting close to the most frequent practice, and this is still a practice that is done fairly regularly. So you now have the information to advocate for yourself and get that delayed cord clamping that research really suggests. The last practice is bathing babies right after birth. So this practice still happens fairly regularly where babies are given their first bath in the hospital and usually within the first hours of birth. But research states that babies do best when the bath is delayed at a minimum of 24 hours. So if where you're giving birth does not follow that delay of 24 hours, make sure that you advocate for yourself and request that the bath be delayed at least 24 hours. And many people just wait and bathe their baby when they get home. So that is definitely an option as well and follows best research. So I know you want to be prepared for the big day. I have put together a playlist of what I think is your next must watch and help you prepare. So check it out right here, and I'll see you guys next time. Bye.